right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern Steinberg School of Medicine, who answers your COVID questions each Tuesday and Thursday here on the Institute for Global Health's Facebook page. So today, Dr. Murphy will be answering viewer-submitted questions that we've received through today, the 23rd of September. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or directly via email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself. My name is Kristen Weber. I am the communications lead with the Institute for Global Health. And so today we will go ahead and get started with updated statistics. So Dr. Murphy, thank you again for taking the time to join us today. So the updated statistics here for the US. So at this time, it looks like 54.8% of the population is officially fully vaccinated, which is great news as that number continues to rise. We're seeing each week, which that means that almost 182 million folks are fully vaccinated, 83% being 65 or older. Any more you can tell us about that?
Well, the numbers are definitely going up. We're still behind Europe. Europe, remember, was way behind us at the beginning, but they have just slowly catched up, and they're a good, I'd say 20 points ahead of us right now. And they're starting to see that effect. So we have to keep pushing and get that number higher.
Absolutely. It's great news as we see it continue to rise in hopes that we continue to see the number of vaccinated individuals rise in the weeks to come, especially going into the winter season.
Right.
Moving on to some big headlines today, we have some big news, the biggest being the FDA approval of the Pfizer booster at 6 months for folks 65 or older or have high-risk jobs or underlying health conditions. Any more you can tell us about this big news?
Well, there's been a lot of back and forth about this, whether it's going to be 6 months or 8 months after your second dose, and then which people are going to be eligible. So I think what's interesting is that they've gone for the really high-risk people again. So if you have an underlying disease or you're 65 years or older, you qualify. So you don't have to have an immunocompromised condition. You just have to have a high-risk medical condition. And they're leaving that a little bit vague. The high-risk jobs that they mentioned in their press release were healthcare workers, teachers, grocery store workers, and people living in homeless shelters and prisons. I think you're going to get a lot of confusion with other people that think they're just as much at risk. Like, why are you making this difference for some of these groups, and some other people are going to really want it. And remember, this only applies to people who've had the Pfizer vaccine. They do not recommend taking the Pfizer vaccine if you had the Moderna or the J&J vaccine. And we'll talk about that later. This is now the FDA based on their advisory board meeting. That's not the end of the story. Yesterday and today, the Centers for Disease Control, the CDC, are having their own advisory meeting, and they're going to come out with actually a more detailed guidance that we're going to have to pay close attention to that because it could be a little bit different. It's going to be on the sort of the same level, but it might be more detailed. So we'll see. That's going to be at the end of today.
That's great news. So more to come next week, hopefully.
More to come. It's kind of this never-ending story.
The next big headline this week has been related to the Johnson & Johnson vaccine itself. I know many folks have been wondering, they received the Johnson & Johnson shot and no word really to come on a booster shot for that particular vaccine, but it looks like they just announced their booster shot. So what can you tell us about this news and how effective is it and what could be the benefits of getting that booster shot?
Yeah, well, it's actually more. There's two things that they released. They released data on a two-shot approach. Remember, they're the only vaccine out there that is just a one-shot deal. But at the same time, they were doing a two-shot vaccine study, and they provided the data for that. They show that 2 shots is better than 1 shot. and that the efficacy may be over 90%. They're even claiming that 94% protection against moderate and severe disease in the United States. Now, the study is relatively old, so it includes a lot of people pre-Delta. So in a lot of ways, although the numbers are great, they're probably not as good as what that number is. But 2 is definitely better than 1. That's the take-home point. They also have a real world study, just people that got vaccinated. And that looks a little bit more like everything else. They're seeing in 390,000 people vaccinated, they're finding that there's a 79% protection against getting infected and an 81% efficacy rate in preventing hospitalization. So that sounds more like Moderna and Pfizer. So very encouraging news. The other kind of unusual finding that came out that I think we're all going to learn a little bit about is that just measuring the antibody levels, they found, now they're very different because the doses are 2 months apart, not 2 weeks or 3 weeks or 4 weeks. It's 2 months. After the antibody levels, which is a big part of the response, it's not the whole thing, but a big part, increased 4 times higher if the second dose was given 2 months after the first dose. But some of the people didn't come in on time, and they came in up to 6 months. And those that waited the 6 months had a 12 times increase in the number of antibodies. So the longer the period between those doses, the better the antibody response. So that was kind of surprising that it was that big. And so I think what we've learned is that the J&J is a reasonably good vaccine. It works probably just as good, but you also have to have 2 shots. So they will be going through the same process that Pfizer is going through right now. They'll go to the FDA. The FDA advisory committee will review all this. They make recommendations that'll go back to the CDC. They'll refine it and make their own recommendations. And then you're going to get a recommendation for getting a second shot or a booster shot with the J&J vaccine. Moderna is going through the same thing. Now, Moderna, there was a big study that the CDC published just the other day looking at the Pfizer, Moderna, and J&J vaccines and the hospital effect on hospitalization. And what they found was that if those people who've taken the Pfizer vaccine after 4 months, the hospitalization protection dropped from 91% to 77%. It's still good, but 91 to 77 is a significant drop. Whereas the Moderna vaccine people, there was no difference after 4 months or before 4 months. So 93% protection against hospitalization before 4 months and 92%. Basically, it's the same thing after 4 months. So they're presenting all their data to the advisory board at the FDA within the next month, and then it'll go to the CDC and there'll be some final recommendation. So right now, the only recommendation for a booster will be the Pfizer, and we don't know the final wording on that. That'll come after the CDC finishes their meeting actually today.
Great news. So across the board, it sounds as though there's more to come in regards to booster shots for all of
the never-ending story. But I think the take-home point is, there's 3 vaccines out there, and they're not all going to be given in the same way. They're going to be given in a different way, and they have different side effects, and they have different efficacy rates, and they're going to have a different kind of dosing. Mm-hmm. The dosing is different for all of them.
Absolutely. Well, moving on to some of our news here locally in Chicago relating to students that are back at school here in the fall. News came out that nearly 10,000 CPS students are in quarantine for potential COVID exposure. And it looks as though there are about 330 students, 329 students, and 142 adult COVID cases district-wide. As we enter, the fall and winter season, Dr. Murphy, what can we expect potentially with these students across the United States that are back in school?
Well, I mean, we're only in the first few weeks of school. We're in the first month for most students, and these numbers are very disturbing. and it's worse in other parts of the country. And I know in LA County, which is a huge school district, they've mandated that every kid 12 years age and older gets vaccinated. And I think we might have to resort to that in other communities as well, because these numbers are probably not going to go down. And this is unfortunate. The whole pool of infection in these children it's much higher, and it's more important than we thought in terms of keeping the whole pandemic fueled. But we've got a vaccine. And then the other good news is that for kids 5 to 11, in other words, then we have all school kids eligible for vaccines under this emergency use authorization. That approval in that particular part of the study will be forthcoming maybe at the end of October, certainly in 2021. And if they get approval, that'll be great. And they've shown that the preliminary reports in the kids show that at 1/3 the adult dose, those kids 5 to 11 mount the same immunologic, at least antibody response, that the older kids and the adults do at the bigger dose. That's good news.
That is good news. Fingers crossed that we continue to see a decline in those numbers as well. I know as we head into flu season, it's definitely, something we want to make sure our kids in school stay healthy. Moving on to some of our viewer questions here, part of the segment. So keeping in mind that there are many at-home COVID tests that folks are able to take nowadays, with the rise of these, can you give us a little bit more information about how this impacts overall COVID tracking for daily numbers?
Well, it is going to be very difficult to actually get the accurate number of people that are doing the at-home tests. The companies do report their sales. So we know how many of those tests are going out into the market. They're being bought by bulk purchase by the US government and different businesses. Our own university has, ample supply of tests for anybody, employee or student that wants them. But we don't know what the results of those tests are. So that's always going to be somewhat of a mystery, but we know that those are going out, and there's other at-home kits that people can just buy off the shelf in the pharmacies. And there's really no good way to track them other than their sales figures. So if somebody does test positive, it is recommended that they confirm that test result and seek help. So a lot of those will enter into the system anyway, and we'll pick them up at that particular point. But it won't be a perfect system, because somebody, if they just had really mild symptoms, say they didn't even go to the doctor, but they had it, that person's not going to be picked up.
Right. It's good to keep in mind. Second question we have is relating to the Pfizer vaccine. So we have an individual that received their first dose at the end of May, so about 4 months ago. Given that some time has passed the further time when it's recommended to get that second dose, do you recommend they still go and get that second dose at this time?
Oh, absolutely. Matter of fact, with the data that we just reviewed, that person may have a better response because of the increased interval. We don't know that. But definitely take the second dose, no matter how long you've waited, even if you're off by a couple months.
Understood. Our third question we have, it looks as though you had previously made a comment in a segment that you had mentioned where vaccinated folks that are 10 times less likely to be hospitalized from COVID than unvaccinated folks, and 11 times less likely to die from COVID compared to unvaccinated people. Right. Can you help to further clarify what you meant by this statement?
Yeah, it's pretty simple. For hospitalization, if you look at 100 people with COVID coming into the hospital, and this is it's an average across the whole country, really. 90 of them will be unvaccinated, and 10 of them will be vaccinated. You look at people that are dying, it'll be 91% of them will be unvaccinated, and 9% will be vaccinated. So you can see that 90% of what's happening in the hospitals is from the unvaccinated. That's why they're driving the infection, they're driving the pandemic, and they're driving the hospitalization use In some states, especially where the vaccination rate is so low, the hospitals and the healthcare workers are overwhelmed.
Absolutely. Thank you for clarifying that. So our last question today, we have a viewer who was diagnosed last year with non-Hodgkin's lymphoma leukemia, who has received 3 Pfizer vaccines at this time.
Okay.
And 5 weeks after receiving the 3rd vaccine, they went for an antibody test, which came back negative. This individual is inquiring if they do have some immunity against COVID, or if they should go ahead and try a different vaccine to potentially have that test then come back positive.
Well, this is a really good question that we really don't have an answer. It starts off with the fact that the commercial antibodies that are available are really not good antibodies to measure, to look at vaccine efficacy and safety from getting infection, So we don't know if those are the right antibodies. Some of them are completely wrong. They're not even measuring the right kind of antibody. So it depends what antibody tests that you had. The studies and the companies, they usually use a panel of antibodies that they're testing. And these are not commercially available. And they're specific for the vaccine produced antibodies. So that's one thing. The other thing is that it's best just to follow the guidelines at this particular point, because the other parts of the immune system are very difficult to measure, very expensive, time consuming. It's not going to be done at the population level. It can be done individually in a research lab, but that's about it. So this person has pretty much done everything they can do. Now it's going to be interesting to see what the CDC says about somebody like this. They've had 3 shots, and that it's all completely legitimate because they had the Hodgkin's disease, they had the 2 shots. Because of their underlying disease, they qualified under the EUA for immunocompromised patients. Now, where does their booster come in? I think technically it would come in 6 months after the booster, after the 3rd shot that this person has, because we don't consider that 3rd shot a booster shot. We consider that sort of part of the original regimen. So I think this is something that this person needs to discuss with their doctor and come to a decision, whether a 4th dose whether a booster on top of these 3 doses is warranted. I would think that it would be following the current guidelines, but they're deciding this question actually today.
That's great. Well, Dr. Murphy, thank you for clarification and advice on that. That is all we have for today. So we'll be back next Tuesday with more on the latest COVID headlines and news, as well as answers to your questions. So please continue to send those to us. Dr. Murphy, thank you so much for your time today.
Thank you, Kristen.